Joining me now from Moncton is the Minister of Intergovernmental Affairs, Dominic LeBlanc. Nice to see you, Minister.
Good morning, Rosemary.
I want to start with the convention, if I can. As you well know, Liberals voted overwhelmingly to endorse the idea of a universal basic income. I know it's not binding. I also know the Prime Minister has said he's not really interested in it. Is this a policy the government would ever consider?
Sure. I mean, obviously, we would consider any thoughtful policy proposition like that. I have a number of my colleagues in caucus who have been working for, in some cases, a number of years on what a universal basic income might look like. There's no doubt when the CERB payment started a year ago, for example, and employment insurance was expanded to gig workers, self-employed people, like the pandemic has properly taken governments to a different posture in terms of income supports. That's a good thing. I'm glad we did that. But it's a thoughtful policy. We also have premiers, Rosemary, including premiers that aren't Liberal premiers, who are saying to us that they'd be interested in looking at like a pilot project of research around what a universal basic income might look like in a smaller jurisdiction. So it's an ongoing conversation, I think a very valuable one.
Even though the PBO has said it could cost $85 billion if you were to do it this year. I mean, it's one thing to do that during a crisis, during a pandemic. It's another thing to build that into funding, into revenue over time.
And that's exactly the challenge, and that's why it hasn't been. If it was very easy, some previous governments would have done it. That's exactly the challenge. And how do you sort of untangle the mix of federal and provincial income supports? Obviously, if provinces have responsibility for social assistance and you go to a universal basic income, what's the nature of their contribution to that? So that's why it's complicated, but it's certainly an idea and a policy that we think deserves a lot of consideration.
Chrystia Freeland talked about how there's an opportunity here to create a national childcare program modeled on a program like we've seen in Quebec. Certainly you're sending all the signals that something's coming during the budget. But Liberals have made this promise many times before. What is different this time? Why should Canadians believe that it's actually going to happen?
Very good question. As some people may remember, I was a young MP when Ken Dryden, who was then Minister of Social Development in Mr. Martin's government, negotiated with all of the provinces and territories a basic national child care agreement that Mr. Harper canceled. But what's different now is the pandemic, again, has shown some of the real challenges for families, for parents, when schools were closed, when people were dealing with sort of distance learning in the school context, parents were working from home. It became extremely complicated and unreliable for many families. So access to safe early learning and childcare, high quality childcare, we think is now an economic imperative as well. It's one social program, Rosemary, done properly that has a direct impact on the growth of the Canadian economy. And economists and people like Stephen Poloz, the former governor of the Bank of Canada, have been talking about that for a long time.
Yeah, you're the Intergovernmental Affairs Minister, so if you're going to get this started, you presumably might be part of those negotiations. Should we expect the first steps towards this in the budget, or is it going to take more time? Could it all happen in one go?
Yeah, all happen in one go. I wish it could. It is complicated, as you say. Quebec has a model which, in many cases, can be an example for the country. So if the government of Canada were to invest money in that, obviously you want to increase perhaps the accessibility in Quebec, for example. Some provinces have mixes of private and public childcare systems. So that's why it's complicated. We'll see in the budget in 8 days from now. But I think Canadians should expect our government to do something very significant in this area, because it's critical for the rebuilding of the economy as well as the social fabric of the country. And it frankly allows parents to participate in the workforce in a way that's not only good for the economy, but it's also good for families.
The Prime Minister says he doesn't want an election. I'm sure you have said it too. But last night, when I was watching him and watching you introduce him, taking jabs at Erin O'Toole, you both sure sounded like people who were getting ready for an election.
Well, Rosemary, you've seen enough biennial conventions of national political parties. When you have thousands of Liberals joining together, in this case virtually, and speaking to one another, it is necessarily a partisan event. It's not a policy roundtable with experts from universities. So
sure,
we
but
shouldn't be surprised that the leader of the Liberal Party...
but you didn't have to go at Aaron O'Toole so sharply, saying that he was disconnected from Canadians.
Of course we did. Of course we did. Of course we did, Rosemary. It's a partisan, it's a Liberal convention. It's not a university faculty club lunch.
That's fine, but it also, doesn't it not also signal to Canadians that an election, you are prepared for one? Whether you want one or not, you're ready to go.
Well, I think anybody in a minority parliament should always be ready for an election. Mr. O'Toole goes on and on about how he doesn't want an election, and 3 weeks ago, 8 times they voted no confidence in the government. So if you don't want an election, like Mr. O'Toole falsely claims to be the case, he should stop voting no confidence in the government. That's the best way to get an election. We've never voted no confidence in our own government.
Okay, we heard from Mr. Carney, Mark Carney, on Friday. He said on Friday, sort of in a weird way, he would be there to support the Liberal Party. I don't know what that means. What do you think he means by that? Does that mean he wants to run for you?
I would hope Mr. Carney might consider running for the party. He obviously has a huge contribution to make to Canada, to the discussion, to the policy around fighting climate change. I thought it was very significant when Mr. Carney agreed to speak at the Liberal convention. I mean, he was Stephen Harper's governor of the Bank of Canada. And when he says he's going to work with the Liberal Party to enact policies that successfully can fight climate change and can foster economic growth and jobs for Canadians, how is that not a good news story? I think he has an enormous contribution to make to public policy in the country. And the fact that he's chosen to do it with the Liberal Party, I think says something very reassuring about the economic direction of our government.
I want to ask you one question about the pandemic before we go. There was a doctor, an Ontario doctor over the weekend, Dr. Warner, who's very concerned, obviously, about the ICU. And he was calling on the Ontario government, or potentially your government, to find ways to bring in healthcare workers from other provinces, which obviously with regulations and certification becomes difficult. Is that something that you have heard that you would look at? Because they are, even if they have field hospitals ready to go, which is a reality right now in this province, they may not have the staff for them.
And that's, Rosemary, been one of the very difficult challenges. I had seen the doctor's comments in the media as well. And obviously, like all Canadians, we worry about rapid and alarming increases in patients in intensive care. Ontario is a difficult example right now. I spoke to Premier Ford late last week, again, as the Prime Minister has, offering to do what we can. I know other premiers, they talk to each other, obviously, and certainly I spoke to Dr. Fury, the Premier of Newfoundland and Labrador, precisely about how we can, in fact, increase the availability of healthcare professionals across the country, because that's the challenge. It's not necessarily a piece of equipment in the ICU, it's to have the trained person to operate that equipment and look after the particular patient. So I would think the provinces will want to work with one another to find these solutions. If the Government of Canada can help, obviously we're there to do so. Many of these regulations around certification of competencies and so on are provincial. But again, the Government of Canada is more than happy to be a constructive partner if there's something we can do.
Okay, Minister, we'll leave it there. Thank you so much for the time on Sunday. Appreciate it.
Thank you, Rosemary. Have a great day.